Let me set the scene. It's your first day on a psychiatric, mental health unit, and suddenly, everything feels alien. The beds look the same, sure, but the atmosphere? Entirely different from the hustle and bustle of Med Surg floors. Now, you might be thinking, why does this feel so different? Well, unlike other specialties that focus heavily on physical care and procedures, psychiatric nursing is about connection and communication, a whole new ballgame. This shift can stir up anxiety, which, trust me, is perfectly normal. Think of it as moving from being a mechanic fixing parts to being a detective, searching for meaning in every interaction. The good news? Most of these first-day jitters fade quickly as you make real connections with clients. But here's a question. How do you even start a conversation in this new world? What if you say the wrong thing? Or worse, what if no one wants to talk to you? The truth is, in psychiatric nursing, your most powerful tools are empathy and active listening. Think of them as your stethoscope and blood pressure cuff, but for the mind. And here's a comforting thought. No single phrase will make or break a client's progress. If you stumble, it's okay to reset. Just say, "That didn't come out right. What I meant was," and keep moving forward. So take a breath. Remember that feeling uncertain is part of the process. And know that every experienced psych nurse started exactly where you are, now full of questions and doubts, but ready to learn. Let's tackle a worry almost every student has. What if I say the wrong thing to a client? That fear can feel paralyzing, right? But here's the reality: therapeutic communication isn't about finding the perfect words. It's about being present. Ever heard the term therapeutic rapport? That's just a fancy way of saying you're building trust by being genuine. Suppose you're in a session and accidentally say something awkward. The client looks confused. Panic sets in. Now, you might think, I've ruined everything. But in practice, you can always clarify. Just be honest. What I meant was, it's that simple. Clients care more about your sincerity than word-for-word perfection. In fact, studies show that consistent empathy and attentive listening have a much bigger impact on client outcomes than textbook perfect phrasing. Think of active listening as your safety net. It means focusing on both what's said and unsaid, tuning in to body language and tone.
If this video brought you value, inspired you, or reminded you why nursing matters, go ahead and give it a thumbs up, share it with a fellow nurse, and don't forget to subscribe to the channel.
So next time your brain freezes, remember, you're not expected to fix everything with a single sentence. The magic happens in the relationship, not in the script. Trust yourself. If you're coming from a place of kindness and curiosity, you're already on the right track. Now, another common concern. What will I actually do here? If you're expecting to spend your day doing blood draws or wound care, think again. In the psych setting, you'll notice fewer physical procedures and much more conversation. Therapeutic engagement and establishing trust, those are your main objectives. At first, you might feel like you're not really doing anything productive. I remember a student asking me, "Isn't it just talking to people?" But here's the twist. In psychiatric nursing, just talking is the intervention. Think of the nurse-client relationship as your treatment plan. Building this takes patience, and sometimes it means sitting quietly with someone until they're ready to open up. You may have heard of therapeutic boundaries. These are invisible lines that keep interactions safe and professional. Learning to maintain them is a skill that grows with experience. So, when anxiety creeps in because your hands aren't busy with tasks, remember, you're doing vital work by simply being present and attentive. Sometimes your willingness to listen is exactly what a client needs to begin their healing. And if you're nervous about starting conversations, know this. Every relationship begins with a simple hello. The rest flows from genuine interest and patience. Let's talk about another fear. What if no one will talk to me? Imagine walking onto the unit. introducing yourself to a client and getting nothing a blank stare, maybe even a turned back. It's easy to feel rejected. But here's where
If this video brought you value, inspired you, or reminded you why nursing matters, go ahead and give it a thumbs up, share it with a fellow nurse, and don't forget to subscribe to the channel. We're building a community of heart-driven healthcare heroes, and I'd love for you to be part of it. Hit that bell so you never miss a story, a tip, or a word of encouragement when you need it most. Until next time, stay strong, stay kind, and keep healing with heart.